By its very nature, the hospital environment is conducive to people falling. Everything from a patient's condition, medications, and physical environment can be contributing factors. The impact on patients is often substantial. Up to 40% of falls result in at least one type of physical injury, often resulting in extended hospital stays. Beyond the physical damage, there's the psychological toll that can come afterward. Hospitals are also negatively impacted. Falls can be costly. Not only can they lead to increased hospital stays, but since they are considered preventable, any related costs are usually not reimbursed. And that doesn't include the negative impact such events can have on a hospital's reputation, which can be significant. But the incidence of patients falling in hospitals doesn't have to be so high. Analytics, or more specifically, multi-source alarm analytics, are designed to pull together a hospital's many data sources to deliver information and knowledge that will improve team decision-making. It may be surprising, but analytics play a significant role before, during, and after a fall event. During a fall, new AI-powered visual sensor technology delivers faster detection with fewer false alarms. By implementing alarm analytics to reduce distraction, this effectively improves response times to catch a fall before it occurs. But the greater value of analytics comes before and after a fall, by having the right information at hand to proactively reduce risk, and by applying forensic research to the sequence of events. The first step in being proactive is to identify the patients who are most at risk. This crucial data is pushed out to managers just prior to a staff huddle, getting the right data to the right person at the right time. By graphically showing the volume of nurse call alarms broken out by bed on a unit, we can quickly identify which patients are generating the most alarms and which are most at risk of falling. What we see in this report is that patients in 76A, 23A, and 24A are generating a higher volume of nurse call alarms compared to other patients on the unit. A customizable live view is also possible, allowing for filtering by location, time period, or priority. Viewing recent data at shorter time intervals can provide staff members with a view of patient activity from the prior shift or as recently as the last hour. Filtering data by priority allows us to home in on a specific type of alarm. For example, looking at bed exit alarms over the previous 12-hour shift gives us a more granular view of patient activity within a unit. By utilizing real-time data, we can immediately identify patients at risk for a fall and proactively address their needs. In multi-source analytics, a second data source can easily be added. This chart offers an expanded view, which by including patient monitoring alarms, helps identify patients at risk based on the activity reported by physiologic monitors. Whether viewed live within a portal or pushed out in a report, this crucial data helps the care team make appropriate clinical decisions. Utilizing analytics during shift huddles can help care teams better identify patients at risk for a fall, manage a patient's needs appropriately, such as implementing a one-on-one or relocating the patient, manage staff resources, and plan admissions, discharges, and transfers. A longer-term view of alarm and patient activity helps nursing management to understand behaviors and better plan rounding activities. More purposeful rounding means a more efficient use of staff time. Overall, analytics make rounding more effective and more proactive. Once again, we're able to filter by alarm priority, location, and time, but this time we're taking a more macro view of the data. Our location selection now covers all units in a larger period of time, in this case last year. The ability to trend data over time provides insight into key times throughout the day when the unit experiences increased call volume. Rounding recommendations allow us to proactively round during the hour prior to peak alarm activity, as well as stagger shift times, adjust medication schedules, or call for all hands on deck during peak times. Filtering data by alarm priority allows us to continue to trend data over time and increase our focus on preventing falls. For example, we can modify the data to show only bed exit alarms. As shown here, the peaks of bed exit alarms vary from the peaks of all other alarms. By helping us identify these peak bed exit alarm times, we are better able to determine which times of day patients are most at risk. This brings us to the other important way that analytics can be used in fall prevention: root cause analysis. With root cause analysis, Managers can correlate multiple data sources over a specific period of time by using forensic research chronology reports. These reports get to the root of what puts patients at risk and determine what types of preventive action will help most. Root cause analysis breaks down historic data in a number of helpful ways, for example, by bed on a specific day or time. This allows for easy review of each sequence of events from all sources to identify patterns and probable causes of falls. Here, we correlate nurse call data with patient monitoring data to capture a true picture of the events leading up to a fall. This combined data provides a view into the physiological events that occurred and details the patient's response to those events. These investigative reporting tools make forensic research easier by correlating multiple data sources to determine what led to an event while detailing the actions taken by staff and patient. Other data sources, including RTLS and staff notifications, can also be added. By identifying high-risk fall candidates ahead of time, alarm analytics help to proactively reduce fall risk. They do this by using patient behaviors for more purposeful rounding, improving response times, helping adjust schedules and manage resources, and decreasing overall noise and stress levels. In the long run, this results in better outcomes for all. Better for nurses, better for patients, better for the hospital's bottom line.